Hello everyone, we are delighted to introduce you to Dentospedia, the premier and the most comprehensive platform specifically designed to help you excel in your dental board exams. Whether you are preparing for NBDE, INBDE, ADC, or any other global dental license exam. So today I'm going to teach you a short topic from the module of Pediatric Dentistry, which is Early Childhood Caries. So let's begin with the topic. Early childhood caries (ECC) is defined as the presence of one or more decayed, non-cavitated or cavitated lesion, missing due to caries or filled tooth surfaces in any primary tooth in a child under the age of 6. So it was previously known as nursing bottle caries. Understand? Nursing bottle caries. So see, presence of more than one decade missing or filled tooth surfaces in a child under the age of 6 is called as early childhood caries. See, etiology and risk factor. ECC is a multifactorial disease from an interplay between host factors, a karyogenic microflora, and a frequent exposure to fermental carbohydrates. Understand? So karyogenic microorganism. The primary culprits are Streptococcus mutans and lactobacilli. Understand? So these are the main culprits which are acid producing bacteria. These are acid producing bacteria. Understand? Now these bacteria are often transmitted vertically from the primary caregiver, usually the mother, to the child, typically via saliva. Understand? C. Dietary factors. Now, frequent consumption of liquids or solid foods containing fermentable carbohydrates or sugar is critical. Understand? So, this is diet. Now, improper feeding practices. This includes nighttime bottle feeding with milk or sweetened liquids at will, breastfeeding after the eruption of the first tooth, and introduction of other foods or a repeated use of pacifiers. Now, lower incisors are often spared due to protective effect of the tongue and constant salivary flow. Understand? Now see, poor oral hygiene, a thinner enamel layer on primary teeth and pre-existing enamel defects like hypoplasia contribute to susceptibility. Now, factors like low parental education, low socioeconomic status, and lack of access to dental care are also major contributing risk factors. Understand? Now see, there are some of the clinical presentation of early childhood caries. See, early childhood caries is typically characterized by initial presentation of dull white demineralization bands along the gingival margins of the maxillary primary incisors. Understand? You can see in the image involving maxillary central incisors. Now see, these initial lesions rapidly progress to yellow or brown cavitations that can eventually destroy the entire tooth crown, leaving only stumps. Now you can see prevention and management. See, the management of ECC focuses heavily on prevention and early intervention. First is establishing a dental home. Which is age 1 dental home. Understand? The AAPD, which is American Academy of Pediatric Dentistry, recommends the child's first dental visit within 6 months of eruption of the first tooth or not later than 12 months of age. Understand? Now, a parent or a caregiver must brush the child's teeth twice daily using a fluoridated toothpaste and educate the parents on no nighttime bottle feeding or sipping juices throughout the day. There should be fluoride varnish application every 3 to 6 months in high risk children. Understand? Now use a smear or a rice-sized amount of a toothpaste. Understand? For age 3 to 6 years, you can use a pea-sized amount of toothpaste. Now counsel caregivers to avoid frequent sugar consumption and eliminate inappropriate feeding habits, especially bottle use past 12 to 18 months and nighttime feeding with a sugary liquid. So that was early childhood caries. See, Dentospedia offers the best resources, expert curated content, and an innovative learning experience to ensure your success. So, for more detailed video or such kind of videos, please download the app Dentospedia and get ready to transform your preparation and ace your exams with confidence. Thank you.